Assalamu alaikum wa rahmatullahi wa barakatuh. So inshallah, we're about to get started. Our esteemed and certified brother Ijaz Ahmed is here for the second session. Alhamdulillah, last time we had a very informative session on estate planning and wills and trusts. This time we'll focus on Medicare, inshallah. And we will, just like last time, let the brother Ijaz get started, but then we will have chance to ask questions and whatnot as well. I'm going to give a microphone to the sister sides as well, inshallah, so they can ask questions. With that, without further ado, I'm going to hand this off to Brother Ijaz.
Assalamu alaikum everyone, brothers and sisters. Thank you for coming in this winter time. I would thank to everybody who has taken the time to come and learn and share this valuable session. In the ladies' room, Tawannapa is there, and she's always supportive. She's always helpful. Assalamu alaikum Tawannapa if you're there, and everyone. I would go first. My name is Ijaz Ahmed. As you know, last time I'm telling again myself. I'm a retirement specialist and Medicare financial professional, state of Georgia. Since I'm a licensed professional, I will not be discussing any product here. This is absolutely an educational session, so that there's a lot of information that gaps there in our community, including myself. I did not know a lot of stuff, right? So Jimmy and Priyam put that flyers, right? It says that it's a decision that you may be stuck for next 30, 40, 20 years. One mistake could cost you a lot of money, right? In Medicare, it's completely different. So first, I'll go slide by slide. I can take the Q&A session at the end, or each slide I can take it also. Either way, it's fine. So if you have any question after one slide, feel free to ask me the question and I'll answer it. And if anybody has any type of personal issues, like one brother was sharing with me, I would say that everybody has a different situation. Everybody's one answer doesn't fit to everybody, right? So please feel free to connect with me and I will get the clarity, give the clarity according to your situation. So with that, my first slide is retire happy, right? I would go that prevention is the main thing. Our main goal, especially my main goal, is to how we can prevent not going to doctor, not going to hospital. As much as we can take the prevention, that will help us from our health, including our financial stuff. That makes sense, brother? Right? So first thing, I believe mental health is number one, right? So look at the picture, a very happy couple. I would say they retired, right? And they are enjoying the life. So we want to make sure that we are happy. And to make our happy, we have to love each other, we have to care each other, right? We have to give good words to senior, right? I would expect, like, when I get really, really old, I want everybody to pay attention to me, right? So that's the thing, we have to do it. If our mental health is happy, if we are happy mentally, physically we can take care of that. So that's what my slide is. I will go to next slide. Whoever in ladies room, I'm going to next slide.
My name is Zoya.
Zoya, we are next slide, which is what is Medicare? We probably know it, right? Anyone has anything to share it? What is Medicare? Because in Medicare, we have a lot of confusion. A lot of time we think that, okay, when I reach 65, I will get automatically Medicare. But Medicare is nothing but just a federal health insurance program. They can listen, right?
Yeah.
Okay. How old are you to get the Medicare?
Very good question. I was going to come that. No, that's fine. That's 65. 65 or older, right? So 65 or older. Once we turn 65, we are supposed to be in Medicare, but there are certain exceptions. Before 65 also, a lot of people might be in Medicare, which is if somebody is in disability. Before 65, if they are eligible for disability, they can take Medicare. Second, if somebody is before 65, they are 24 months or 2 years in Social Security disability benefits. So they are eligible for Medicare. Right? Got my so far? You got that right? Anyone has any question? Right.
Hello.
Yeah, I'll leave this if it goes out, then I don't know. Let me check. I can give you the microphone.
Yeah, microphone. So yes, 65 and older.
It's not wireless, sorry.
So I want to touch Medicare 65. It's very important, and a lot of time, a lot of people come from back our country, right? Late in 50s or 55. Sometimes one information is missing, that they need to get the Medicare, especially Part A, right? They have to have 40 credits. So you must have to have 40 credits in order to eligible for Part A. I'm going to come that in next, but it is very important that you make sure even you work part time, anywhere you can get that quarters credit in your Social Security side. Any question here? So make sure that to get Part A, you have to have 40 quarters. So I'm coming Part A next time. Those are the things, Medicare Part A or B. But everybody has to earn. Most people that we work in America, right? We already paid Part A premium through our paycheck. If you look at your paycheck, there's a FICA tax that we pay. Part of that FICA tax goes to Medicare, and another one is Social Security. So to eligible for Social Security, you have to have 40 quarters. Which is 10 years, right? 10 years, 40 quarters. So how 40 quarters, how this works, if you work like let's say 40 years, Social Security will take the 35 years of maximum work that you put it there, and they will calculate. They have a formula to calculate it. So probably we will do another session with just Social Security, how it works. That is also, I think, very important, that a lot of people do mistakes when to take it, right? It's another biggest retirement money sitting there, that you have to be very careful. How you can maximize it, that is another topic. So I'm going to go there another day, right? Jimmy, we can do another session. Inshallah. So today I'm going to touch Medicare only, and I'll try to put very simple way. Very simple. Medicare it's really complicated. Once you turn 65, before you turn 65, you will get a book. And that book, you can read it, but still a lot of things, we don't understand. The biggest part of, I would say, in American healthcare system is, you cannot exactly know how much your medical bill will come, unless you see that one in, practically when you go to doctor's office or hospital, there's no way somebody can tell, the doctor can tell, the insurance company can tell, okay, this will be your medical bill. There's so much hidden underlying. So it's very important that, we understand these things, how it works, so that we can take the decision. So I'll go to Zara, right? Zara? Zoya, I'm sorry, Zoya, I'll remember it.
The younger sister this time.
Okay, Zoya, we are in next slide, which is who should enroll in Medicare. So, is everybody is in Medicare or not yet, right? So I'm going to touch it. Who should enroll? Number one, if you are not working or your spouse is not working, you or your spouse is no longer working, which means we don't have employer's health insurance, and we are turning 65, we must have to come in Medicare. Number two, if somebody has Cobra insurance, a lot of time people get that Cobra insurance for 6 months to 18 months. If you're in Cobra insurance, you have to come in Medicare. Number third, if somebody is in retired retired military officer, retired military personnel, they have a TRICARE insurance already from that place, they have to come in Medicare. I'm going to come. If they don't come, what will happen? Number fourth is, if somebody is working under a small employer group. What do I mean by small employer? That means in your workplace you have 19 or less employees. If you work under that employer and you have the health insurance, you must have to come in Medicare. Not 19 employee should have health insurance if they have 19 employee in payroll, and they maybe have 3 or 4 employees, they are getting the health insurance and you are one of them, you have to come in Medicare. The last one is Obama Healthcare, we know it, right? Former Obamacare or Affordable Care Act. Anybody is an Affordable Care Act, if they turn 65, they will have to come in Medicare. If you do not come in Medicare, you will have a risk. So I'm going to come touch that one, risk. Any question here? Good? Okay. Zoya, I'm going to next slide, which is, what is the window of enrollment? When do I enter in Medicare? What is the timing would be? This is very important. If you miss the timing, you will be out of that zone and coincidence will happen, right? Like I said, one mistake could jeopardize me for whole next 20-30 years. So initial enrollment period, that is the timing. So what is the timing? It depends on your birth month. So let's say you are turning, your birth month is which one? Let me tell. Okay, next is, let's say in March, somebody's birth month is March. So from March 3 months before and from March 3 months after, total 6 months, right? And in between March is 1 month, so total 7 months window. I can, what is it, start monitoring.
For upgrade, you can continue if you want to.
Okay, Zoya, I'm going to next slide. This is the one I put it. Actually, most of the session that I do the whiteboard, but since our sister's room is, they cannot see it, so we are doing it in the slide. To make it easier, I put it this way. Can you see the picture? Initial enrollment period is right here in the middle, 65, right? Let's say whatever the 65 it could be any month, your month. So 3 months prior or 3 months later, you have total 7 months window. I would definitely encourage and request everybody, make sure you do it from the beginning, right? Whenever you turn 65, take first 3 months, first month, touch it there, and before that even you start planning. You talk to a professional, whoever you trust, you believe, right? If you have someone, you sit with that person and tell that okay, I'm gonna go in and study on that one. Where are you gonna do? What you gonna do? Those things. So 65 or any question here? Am I going too fast or we good?
Okay, I have a question.
Sure.
Once you 65, I thought Social Security, they take care of you. You don't have to do nothing. Is that correct?
Social Security, he asked me a question that
65.
once we turn 65, Social Security is going to take care of us. So take care of the Medicare side also?
Yes.
Okay. Here's a very good question. Yes, I was going to touch that one. If somebody already, a lot of time people take their social security before 65, right? We know that probably, like it starts from 62. So if somebody is already withdrawing social security before 65, they don't have to apply for Medicare. Social security will auto enroll them. So when we turns your birth month, before your birth month, you will get that Medicare card. We clear? So if somebody is already in social security benefit, separately they don't have to apply. But if somebody is not, a lot of time people delayed social security 65, 67, you know that, right? 67 is the FRA, which is full retirement age.
Retirement.
Yeah, so if somebody delayed, they have to apply it. Very good question. Thank you for that. Zoya, I'm going to next slide. This is the card, you will get it in your mail when you apply it. So you can apply it in person, you can go to the social security office, or you can apply it in online. It's not complicated, it's very simple. I have helped too many people. If anybody needs help, I can help that person to apply. Right? You can go to social security site and you just put your information and you will get your card in your mailbox. You can look at it here. It says Hospital Part A, Medical Part B. So Medicare has, this is called original Medicare, right? It has two parts, Part A and Part B. So remember I was telling Part A, we already paid through our paycheck. So we don't have to pay for the premium because we paid it. But everybody has to pay Part B. So a lot of time people think that, okay, I have the Medicare already, right? Why would I go? What is the thing next I have to do? So I'm going to come in next. Any question here? We're good? Yes, Jimmy.
Just letting you know that there is a microphone on the sister side too, so they can ask.
Okay, there is a microphone in ladies' room. If you have any question, please feel free to ask me. And if you want me to slow down, I'll slow down. Assalamu alaikum. জি বল আপনি আর একটু জোরে বলবেন কাইন্ডলি
আমি সিটিজেন
জি
বাট আমার হাজবেন্ড সিটিজেন না কিন্তু উনি এখানে 14 বছর আছেন একেবারে পার্মানেন্ট রেসিডেন্ট ওনার বয়স এখন 69 বাট উনি কি আমার সাথে মেডিকেয়ার পাবে আমি মেডিকেয়ার পেয়েছি বাট ওনার জন্য আমি কিছুই পাচ্ছি না এখন এই সূত্রে উনি বেশ অসুস্থ ওপেন হার্ট সার্জারি অ্যান্ড বাই এভরিথিং ওনার প্রেশার হাই ডায়াবেটিস কানে শুনে না মনে রাখতে পারে না উনি ওনাকে আমার টেক কেয়ার করতে হয় বাট আমি ওনার জন্য কিছু পাচ্ছি না এই সুবাদে কি করতে পারি আমি কিন্তু উনি 14 বছর এখানে আছে
সো আপনি অ্যাপ্লাই করেছেন কি ওনার জন্য উনি যদি সিটিজেন ওনার সিটিজেন হতে হবে কি আমি যতটুকু জানি
উনি সিটিজেন তো মনে রাখতে পারে না কিছুই মনে রাখতে পারে না
না উনি সিটিজেন কিনা উনি সিটিজেন না আচ্ছা
বাট ওনার 27টা ক্রেডিট আছে উনি কাজ করতে 27 ক্রেডিট
জি
40 ক্রেডিট হয় না কিন্তু কিছুই হচ্ছে না উনি আমি ওনার এমএটা কিনে নিয়েছি করবা ব্যাংকে আরো
হ্যাঁ এখন তো আরো এক্সপেন্সিভ আপনি একটা কাজ করেন কাইন্ডলি আমি আমার নাম্বারটা দেখবেন আপনি আমাকে পার্সোনালি আমি আপনাকে দেখি কোন অল্টারনেট কি আছে আর কি হ্যাঁ যদি কোনো কারণে আপনার এটা অ্যাপ্রুভ না হয় আমি বিলিভ করি যে দেয়ার ইজ অলওয়েজ সামথিং কিছু না কিছু আছে আমেরিকাতে কেউ এরকম না যে একদম কিছুই পাবে না হয়তো গভর্নমেন্ট সাইড থেকে পাবে না কিন্তু এরকম অনেক সোশ্যাল অনেক কিছু আছে বাট আমি আপনাকে পার্সোনালি ওই ইয়েগুলোতে আমি হেল্প করব আপনি আমার নাম্বারটা নিয়ে রাখেন অবশ্যই আমি করব অ্যাবসলিউটলি So I will go to the next Zoya. I'm going to next one. Any question here? Medical part A, part B. Any question? Yes.
Is it necessary to be the like citizen here, or green card holder also can apply for the Medicare?
Yes. As long as you're green card, yeah, they can get it.
Okay.
Yes. They don't have to be citizen, but green card holder will work. Thank you, PM. That's a good question. I'm going to Zoya. I'm going to next slide, which is what option are available. Once we get the Part A and Part B, we have two choices, two options. Everyone has to go either left or right, right? You cannot be just holding the Medicare card. Okay, I have the Medicare Part A and Part B. I'm done. You can hold it. Some people do by mistakes or by their choice, but you will have a financial risk. Financial risk is Medicare doesn't pay 100%. Medicare pay 80%, and the 20% you have to pay. You are responsible, and that 20% sometimes, depending on the health condition, everybody, right? It can be huge. So that's why people go to two different directions, right? I'm going to that two different direction. Zoya, I'm going to next slide. Here you can see you have just two choices. Some people, I don't know, maybe one or anybody, they can take Part A, Part B and have independent or standalone Part D. That is, D is prescription drug coverage. In health insurance before 65, we know that if we have the insurance, everything is covered, right? Like our medicine is covered, our everything is covered. But when you turn 65, Medicare works different way. Part A covers your hospital bill. You have to pay deductible copay, that's a different. Part B covers outpatients.
How much is Part B?
Part B premium, I'm coming, yeah. No, that's fine. Part B is, last year it was 184, and this year 2026 will be $202.94. Let's say $203 per month. So Part B pays outpatient. That means if somebody is in the hospital, inside everything pays Part A. But any doctors comes, any specialist comes, that is Part B. Or outpatient, or you go to the outside of the hospital, right? Sometimes you go to the specialist and all these things, right? That covers Part B. So it's two part. So once you have that one, then you can see the left side is Medicare supplement plan, and right side is Medicare Advantage plan. You just have two choices. Right here, people has to be very careful with choice. I cannot tell that, okay, this is good, that is good, right? Everybody has a different situation. It comes with health, it comes with your finance, everything related. So I'm going to explain you in next slide, but you have just two choices. One is Medicare supplement plan. You have Part A and Part B, plus you get Medicare supplement plan. And another one is Medicare Advantage plan, which is MAPD. Is it complicated? We are good? Any question? Ladies room, we are good? Okay, Zoya, I'm going to next slide. This is the one, it's my own handwriting. I wanted to do it slide here, write it down, but this is what I did it. You can see in the picture, this is the Medicare card on top, right? So you have two choices. One, you keep your original Medicare and you have standalone D plan. I'm showing you the left side, right? Original Medicare, Part D, and in the bottom it says Supplement Medicare. Supplement plan or Medicare. It's the same thing. Or you come on the right side, which is Advantage plan. That one the Medicare, original Medicare will be replaced by a private insurance company. They will administrate the same thing, but it will be replaced. So you will have Part A, Part B, and Part D bundled together, which called Part C. So one is supplement plan, one is MAPD. You may heard that MAPD, Medicare Part A, Part B, Part D. Medicare Advantage Prescription Drug Plan, which is MAPD, and the whole thing called is Part C. Any question here? I'm going to go to next. So On Advantage plan, you have HMO and PPO. When you pick it, you can pick HMO or PPO plan. You sit with your, whoever professional, and you sit with them and they will walk through you. And supplement plan has a deductible $250. You can see I write it down, $250. And Advantage plan deductible 2,500. This was 2 years ago, but now it's more. So I'm coming back to next page, Zoya. Any question here? Or it's too complicated, or Medicare itself is complicated. I could not make it simpler than that. Yes, sir.
This year is 25 and 26. There is any difference?
25.
But the current year and the next year.
Yes, price is everything is different. Every price deductible.
Lower or higher?
It's always higher. It will never be lower. It will always be higher. Yes. Any question from ladies' room? We are good?
Yes, I have a question.
Yes.
My mom has Medicare Part A and B and also Medicaid, but she never worked this country. Now she doesn't have any dental insurance. And what we can do to obtain the dental insurance? Should we enroll for the Advantage? Because it looks like Medicare Part A and B is suitable for her, and she doesn't even interested taking any other, Medicare like Advantage or D. But she doesn't have any dental insurance, and we have to pay out of pocket. What to do?
Okay, so she has Medicare and Medicaid, right?
Right.
So Medicaid is not covering anything in Part D. I mean dental.
No,
Did you apply or did you do anything?
we didn't apply, but we gave both of the card number to the dental office, and they checked, they verified, and they said she doesn't have any dental coverage.
So I would suggest you call Medicaid and tell them that if they have any dental thing in their plan to help you out, they may reimburse you if you qualify. Because if you are Medicaid, that means you are qualified for that, and you may have that one. If you don't ask, you may not get it. But if you go to doctor's office, I mean, it's not in their hand. You have to get it through the Medicaid. And again, you have my number. I'll display it. If you struggle anything, personally communicate with me. I will try to call, communicate, see if there is anything there. See, Medicaid help is everybody gets different on their category, their everything. So you may qualify or you may not qualify. And if you don't qualify, I will find out if there is anything low cost or zero cost sometimes, because on Advantage plan they have like zero cost a lot of things. But again, their underline also, they don't cover a lot of things either.
Yeah, and then we have premium for Medicare Part D. So what if she doesn't need that much, but we still have to pay for Part D?
Correct. Part D, I would say, no, Part D is prescription drug coverage.
Yeah, but
You are saying dental, right?
right, only dental.
Yeah, dental is different. And Part D is prescription drug coverage.
Right, but I heard that to get dental coverage, she has to have some kind of Medicare Part D, like the Advantage plan or supplemental Medicare. But we never applied for any Part D because I think she's not eligible because she didn't work.
Okay, you're saying Part D, right?
Yes.
Part D is prescription drug coverage. It should be in Medicaid. Medicaid should reimburse you or give you something. Call Medicaid and tell them, or you can connect with me. I'll see what I can do.
Thank you, sir. I first call Medicare then.
Yes. Try to tell them that, hey, I need this help.
You're welcome.
Good question.
Yes.
What is the income limit for qualify for Medicaid?
It just, Medicaid has different categories. So it's probably in your bank account has to be less than $2,000, right? So make sure you can check it. If you Google it, if you go to the Chat GPT, ask them and they will give you exactly. But it has different. Medicaid has different health category. So sometimes you may get just because of your income, they may just give you option this. You may not get the whole thing. So it's always good to apply it and see what they cover. But without knowing, I exactly don't know how much exactly level, your income level and all these things. But for sure, I know that they will look at your bank account, like how much is there every month coming. And you have to actually put all the information there.
So your total income of family of 3, and it'll depend on the family size.
Yeah, all
Has
these
to be
things.
less than 2,220 per month.
Yeah.
Less than 2,200 for a family of 3, not single. But,
Yeah.
yeah.
We're good. Any question?
I have a question. What is the difference between Medicare and Medicaid?
Medicare, it's in health insurance, and
Medicaid?
yeah, Medicaid it's just whoever cannot pay, they will help the Medicare to come to help those bills and pay those bills and all these things.
Can
So
a person can have Medicare and Medicaid as well?
both, yes. Actually, you will have Medicare, but since Medicaid will take care of few stuffs, certain things, and Medicare will. It's a combination of things. But mostly is Medicaid is 2 things. Either you have to be like disabled before 65 and all these things, or after 65, certain disease, all these things, right? And also it is related with your income category.
Income.
Yes.
You have both?
Thank you.
Well,
You have both?
No, I'm just asking.
just general question he's asking. Everybody is good so far? Sir? You are not asking question today because you are an you know it probably a lot.
No, I don't know.
Okay, so now it comes with money. Everybody is interested this one, right? Finally, what would be my monthly premium? Zoya, I'm in the next slide. What would be my monthly premium? So I'll go after that again, another slide, next one. So this one is actually last year. This one I was doing one session on online Zoom. So I did that one and I copy pasted, put it here. So it says Medicare health insurance, right? Hospital bill and part B, you can look at on top, $185 per month everybody has to pay. But this was for last year.
This year.
This year, yes. And last year, 2024 was $174. So I thought it was going $10 up. But 2026 is $202.96 almost per month. So this one, everybody has to pay every month. Unless, the question you said, unless somebody is qualified for Medicaid,
Right.
then Medicaid will help that part. You may not have to pay at all, or some maybe, depends, right? So once you have this one, make sure you know that most of us, they don't have to pay part A because we already contributed. But those, remember, those who doesn't have 40 quarters, they make sure they work there, or they have to, if they do not take it, they have to pay penalty for that. So make sure you have to have some kind of insurance if you do not take Medicare. So if somebody doesn't qualify, like doesn't have the enough 40 quarters, and they are 65, right? And if they see they have a lot of bill in part A, part B, they can take still something else, maybe Affordable Care Act, but they have to have some kind of health insurance. Medicare will look back how many years they were out of insurance, and they will calculate it, and that will be a penalty for lifelong if you do not take the Medicare when you are supposed to be. This is the one I want to emphasize. Everybody who turns 65, make sure you know these rules of Medicare. You have to take it. So next is coming, number one. It's good that I put number one here. Supplement plan. Supplement plan, you will have original A and B. Separately, you have to buy part D, which is prescription drug coverage, standalone. And then separately, you have to buy supplement plan, which is, I put it 145, but this year it is around $160 per month. So 160 per D, I put it 25, it's not 25, it's 40, 50, $60 depend on, right? But approximately, to understand this math, just to make it simpler, overall $400 budget you have to have if you take the supplement side per month.
What does the supplement cover?
Supplement will cover pretty much everything. Dependent supplement plan also has G and N. So mostly it will cover pretty much everything other than medical prescription, medical deductible $257 that I showed it before. That's the only one.
So what would cover dental based on the question before? Like, is there any dental coverage?
Dental, you have to take right here D separately.
D?
Oh, I'm sorry, dental. Oh, I'm sorry, guys. Got confused. So yes, dental you have to buy separately also.
Separately.
Yes. We are not talking about dental at all here.
Oh, that's what I'm saying.
Yes, dental is separate. But on Advantage side, you have a dental.
Yes.
Yes. So both side has pros and cons. You have to calculate, okay, how much money every month I'm giving here. Let me finish the Advantage also. So Advantage plan has A, B, and D. Don't confuse with D. D is not dental. D is prescription drug coverage. So together it's a bundle package, and the premium is mostly $0. Most of the Advantage plan premium is zero. Sometimes $10, $15, $20, but mostly zero. Whoever I help, everybody has zero. So what is the thing? Simple. If I simplified it, supplement plan is you pay upfront premium, and you don't want to think about what will happen in the hospital. You don't have to worry at all, right? But in Advantage, you don't pay anything that much. You don't pay nothing pretty much. But as you go, you have to give the money. When you go to the hospital, you have to give that part, portion. Medicare, of course, will cover 80%, but for that 20% that we are talking about, there is also limit. The Medicare Advantage plan has sometimes $4,000, $9,000 maximum out of pocket. So your risk would be MOOP, maximum out of pocket. You just remember that thing, how much is the maximum out of pocket. So maximum out of pocket could be $7,000, $8,000, $9,000 every year. So to simplify it, supplement plan, you pay now, premium every month. You may not have to go to hospital that much, but you have to pay. And Advantage plan is you don't pay anything, but if you go, well, you will pay. It depends on your health condition, budget, your financial situation, everything. So you have to just sit down with a person to analyze these things, and then you make the decision.
Is the maximum out of pocket different than the deductible you were talking about earlier, which was $2,500 in the Advantage?
Yeah, he asked me maximum out of pocket and deductible. Deductible is one, maximum out of pocket is another one. So let's say deductible is $1,000, right? Medical deductible. So you will pay from medical deductible, you may have to pay $100 or $200. And then you will have co-insurance, co-payment, all these things. The way you go it now, right? But your maximum, you know that what is the maximum risk I have it is maximum out of pocket. Once you reach that one, God forbid for any reason, right? If somebody pays, let's say maximum out of pocket is $7,000, and somebody is in the hospital, they already paid that amount, 7,000 in February. From March to December, they don't have to pay anything. Nothing, simply because they already paid it. Is it simple or not? Got it? Complicated? Still, it will go out of the over your head sometimes, but this kind of session you need a lot, and especially this is kind of general idea I'm giving you. You still need to sit down. I would say that sit down with a person. Your situation may be different. Okay, I'm going to next part is, okay, this is the one. So basically these are the things simplified, right? Like what are your use risk? You have to, number one, you have to do on time before your birthday comes. Make sure you prepare that one. Talk to whoever professional person that. If you have a person, talk to them. If anybody wants to communicate with me, feel free to come. I will guide you. I will help you any way you want with giving the right information. Second, you remember once you get the Medicare card, prepare for the which way you're gonna go, supplement plan or advantage plan. You have to pick one.
Which one is better, advantage or supplement?
I cannot say which one. Both. I have both sides, right? Like let's say I'm a licensed. I have both side entrance, but it all depends on what is your situation. It's very important to know your situation, because let's say you are paying supplemental $400 every month, and then you cannot afford anymore, right? But I want to say one thing for sure. There is a one catch. Supplement plan, when you turn 65, you will get one-time opportunity only to take the supplement plan. This is very important, one more time. When you turn 65, you will get one-time opportunity to pick up the supplement plan without any underwriting. Means without any medical condition or anything. Anything somebody has it, doesn't matter. Supplement plan is guaranteed to give you that one, no matter what condition you have. And supplement plan will never expire. Will never be. You will be in supplement particular that plan forever. Nothing will change other than premium. Nothing will change. Nobody can tell you, okay, this cannot be, that cannot be. This is guaranteed. The only guarantee is not there, that premium per month. Premium per month will go up and up as you grow older and older, each age, right? That's the number one thing. So what happened if somebody after 1 year, 2 years, they are not taking the supplement, but they took the advantage plan. Now after 2 years, they realize they did a mistake. They should go back because their health condition is not good and they are paying a lot of money. So now they are thinking, you know what, I should take the supplement plan. Can they take the supplement plan? Can they approve? Depends on their health condition. If the health condition has underlying, then insurance company may deny it or give you a really high price. So that's the thing you have to remember. And supplement plan you don't have to change at all. This is your permanent. But advantage plan, every year you can change it. Or insurance company can also change it. So that is the very important thing. Yes, sir. Ask me a question?
No.
Okay. Any more question in the ladies side? This is Medicare is complicated again. I put it Medicare. It's a mess. It's totally a mess. It's what I see. I would say for health insurance, while dental, I don't know who asked me. As a financial, I do the health insurance also, right? What I did two investigative video. I went two dental places. I had my dental insurance, right? The dental insurance says that you can get two basic cleaning in 1 year. We will approve you. But when I go to dentist, they are not giving me that cleaning. When I call insurance, they said no, they should give it. And they are not denying what they are telling. I have to do all these things. So they want to make sure that my bill goes at least $2,000-3,000 or more than that, or means they don't want to give basic things. I was really tired of that dental insurance. Finally, I had to cancel it. Another thing, I just remember it, I want to touch it. A lot of people don't know the eye insurance things. I want to touch it. It's not Medicare, but I'm just telling regular way. A lot of people don't know. If you have a health insurance, your eye checkup, not the regular checkup, which is your, you need to change the power and all these things, not that one. But anything beyond that, it is not actually eye thing, it is the health insurance. So you are covered for your any kind of eye exam, the one in the backside, or if you can tell that I have some pain, glaucoma or anything, right? That is covered in your health insurance, regular health insurance.
So you need another also to buy more eye insurance if you are on Medicare, because it doesn't cover eye insurance. Like if you need glasses, you need whatever.
You need, for glasses and all these things, yes.
So you need another insurance for that.
Yes.
And you need the dental also.
Right. For Advantage plan, you have a lot of dental and eye coverage. The Advantage side has, but not everything. You just have to look at it to know what the coverages are.
Are you able to have Medicare with another, like today, for example, you could have two insurance. One is like primary and one secondary, right? Like if you have two companies, or you and your wife, everybody works in a company, and you could be on both the plans, and one company covers something, whatever. Is that the same with Medicare, or Medicare doesn't accept anything? You're either on Medicare or on another insurance. For example, if I'm still working till 65, can I put Medicare and my employer health insurance? Or if my wife is working and I am on Medicare, can I be on both insurance, or you have to be on one, either or?
Okay, this brother said very, very important question. He said, I'm going to give you this one more time so that you can repeat and I will.
Okay, the question is, can I be on Medicare and on another insurance? For example, if I'm still working, I can use my employer insurance, or if my wife, for example, is not on Medicare because she's younger, but she has an employer, and I could be on her insurance besides my Medicare insurance. That's the question.
So he asked a question that might take another half an hour, but I'll go with it. Just kidding. Okay, it's a very, very important question. I should touch it in between. That he said, if he is in 65 and he's still working, can I have employer insurance and the Medicare, right?
Yes.
So it all depends. Yes, you can have both. Again, if you have your employer is 19 or more, like I'm going to give you an example. Like I'm going to give you an example. This is a fictitious. I don't say anyone's name, but to make it understand the story, real story. So he's a doctor. He was going to take the Medicare because he knows. Somebody said it, right? Our information comes with our friend circle, whatever you know. But his employer is a large employer, and I said you don't have to take it because I know that. We discussed it. His health insurance is very good. His employer health insurance is outstanding. And he's turning 65. He doesn't need to get Medicare. So, how about your employer health insurance is not that good at all, right? You compare it and then you see, okay, now my Medicare is much more better because I only have to pay Part B right? And this one is 300, employer is like $275. You know what, I'll take the Medicare. So when you turn 65, yes, you can have both, depend on what is your employer thinks. But if that employer has 19 or less, you have no choice, you have to take this one.
No, I'm saying like if you have like simple example, you could choose because you have a big employer who gives you health coverage, and instead of going like with the expensive, like everybody knows now, like health insurance, even through your employer, is very expensive. You go like the full one that gives you the enhanced whatever 90, 10, whatever, or 80, even 20, still you pay like almost $1,000 a month for these insurance these days. So maybe you could say, you know what, I could pay A and B, cover hospital, cover the Medicare without paying a lot, and maybe go with HSA with my employer, pay less, and still cover for like drugs and everything else until I whatever, but I can get like the big bills could be covered by Medicare, like hospital and stuff like that. These are kind of scenario.
Yes, you can. Medicare will only look at it if you have creditable coverage. So if you have a creditable coverage from employer and they are giving those things like prescription drug coverage and that thing, yes, you can take that one. You don't have to come Medicare at all. If you have, let's say, employer coverage till 80 or whatever, right? And that one is when you don't need to take Medicare. And if you come in Medicare and after 80 years, just I'm giving an age. Medicare will only look at it, you had creditable coverage throughout your 10 years or 5 years. And you have to fill up some forms definitely when you come to the Medicare. You may not have to come Medicare at all, you don't have to. So you can have another thing, maybe I should touch it. In 65, my insurance and my wife, it's a two different, not together, not same. No, we cannot have same, covered at all. She will have her separate Medicare, I have my separate Medicare.
Even if she's not 65, she still can get Medicare.
No, if she's not 65, then she has to wait.
Okay.
Right. But if my wife has a employer insurance coverage, right? Let's say she's working and she is covered by her employer and I can be under her. And now I'm turning 65, my $185 and all these things is expensive, right? And my wife's insurance, I can be less expensive premium and everything. Yes, I can take my wife's one and I don't have to get Medicare. I don't have to enroll it. You can still take Part A, you can apply, and when you get the Part A and B, just return the card again with a form. I have it, I can help you, saying that I'm returning the Part B because you have to pay for Part B. But Part A is yours because you already paid for Part A. Now why you will take that one? Because you are taking on your wife insurance also and you are taking Part A also. Why it is good thing? Because God forbid if something happen, I go to the medical, right? There is a gap, right? Now this gap, first payer would be my wife's insurance, the second payer would be this Part A. So I will be fine. So,
and if I switch later to Medicare fully, I will not need that. I will be still covered. I don't have to worry about filling forms or I was not covered, whatever, right?
Right. He asked if you come back in later on again in Medicare, do you have to be worried about the? No, you don't. As long as you had the insurance, you're fine. Medicare will only look at it. They will look back your history, right? You have 5 years. Okay, this 5 years you had the insurance covered. You were under the insurance, and you have to fill up the Form 2 form and make sure your employer has to sign that one.
But I mean, if you're on Part A, you don't have even to fill anything, right? Because
no, Part A, yes. Yeah, only for Part B. Yeah. Good so far? Okay, I'm going. The last slide is my number and everything. If anybody has a lot of time, that unique situation, a lot of people has it, right? And some people may not ask this question open because this is kind of really, really sensitive question. So feel free to call me, feel free to connect with me. I will help you any way I can. My phone number here, it says 805-304-9995. Even that I have access, I can call, I can get the information, I'll help you anything. This is a masjid, and this is just a service that we are committed, me, Jimmy and PM, we are committed to do no matter what to people that they come here to help them, right? This is a great thing. I feel really good to get involved with masjid. This is a big thing for me. So even that, I am a licensed financial professional, right? Even that you don't do anything from me, I will still be helping you 100%.
Jazakallah khair. MashaAllah. Reward you.
Thank you so much.
Appreciate it.
And last one is, just take this one. Thank you.
Thank you.
Thank you.
We're looking for the social security one.